2-minute anesthesia, pharmacology, pharmacodynamics, anti-epileptic agents. It's important to be able to easily and succinctly categorize anti-epileptic agents. This can be done in multiple ways. One way would be to determine the mechanism of action. However, it's important to note with anti-epileptic agents that most agents have more than one mechanism of action. However, for simplicity, we've placed them in 3 different groups. Those which inhibit voltage-gated sodium channels, those which inhibit voltage-gated calcium channels, and those which enhance the effect of GABA. Those which inhibit voltage-gated sodium channels include carbamazepine, valproate, and lamotrigine. Those which inhibit voltage-gated calcium channels include phenytoin, pregabalin, gabapentin, levetiracetam, and those which enhance GABA is benzodiazepines. The side effect profile for anti-epileptic agents is broad and significant. Common side effects for all agents are dizziness and sedation. Important agents to note will be phenytoin. These have idiosyncratic and concentration-related side effects. Concentration related to increasing concentrations and therefore toxicity. Patients develop neurological symptoms from simple tremor all the way to drowsiness, seizures, and death. Idiosyncratic reactions include dermatological reactions, acne, hirsutism, gum hyperplasia, and hematological, folate, aplastic anemia, and insulin inhibition. As you can see from the table, there's a long list for each agent, but this is clearly not exhausted. This diagram shows the mechanism of action of anti-epileptic agents. Seizures occur due to the increased excitability of neuronal tissue. Glutamate is the main excitatory neurotransmitter in the nervous system. As you can see from the diagram, there's the pre- and postsynaptic neurons. Voltage-gated sodium channels allow propagation of the action potential down the presynaptic neuron. Once the action potential reaches the axon terminal, this triggers the influx of calcium via voltage-gated calcium channels. This mediates glutamate release. Glutamate then diffuses across the synaptic cleft and binds to the appropriate receptors. These include AMPA and NMDA, resulting in sodium and calcium influx respectively. This causes depolarization of the postsynaptic neuron, allowing propagation of the action potential. GABA is also present via an interneuron which binds to the presynaptic neuron. GABA is released and binds to the GABA-A receptor, allowing chloride conduction into the neuron, and this lowers the resting membrane potential, reducing cellular excitability. As you can see from the previous slide in regards to the mechanism of action of anti-epileptic agents, these can be categorized into those which block voltage-gated sodium channels, those which block voltage-gated calcium channels, and those which enhance the effect of GABA. All of these effects will reduce the excitability of the presynaptic neuron.